BWF Solicitors, we take pride in our client service. As a niche law practice, we are conscious of the demands of our clients. We always offer a friendly, listening ear and sympathetic attitude. We've worked with thousands of people all across the UK in all areas of personal legal services. We have received great feedback and reviews from our clients. We are located at Seven Sisters in Tottenham on the 4th floor of the Anna House, right on top of the Victoria Line train station for your utmost convenience. We have a friendly office and provide all of the refreshments necessary while you wait to see a lawyer. We are dedicated to our clients and have a successful record of serving our clients. Solicitors of England and Wales are of high quality and are bound by the highest professional standards. We are officers of the court and are bound by standards of integrity, competence and conduct as part of our responsibility to uphold rule of law. Our solicitors and lawyers care about your case and are committed to providing the best possible service to you in the most considerate and careful manner. We hold 2 Law Society quality marks. Law Society accreditation helps to demonstrate that we have attained the requisite standard in the area of law and have the requisite expertise. BWF Solicitors, we're here to help you with your legal services when you need us.
Hello, ladies and gentlemen. Welcome on this beautiful Saturday to Heritage TV, hanging out with Vicky. As usual, today is our legal hour show, starting at 12 noon. This program is sponsored by Petition Estates Limited, your property professionals. If you want to sell your property, rent your property, or want your property being managed, look nowhere else than Petition Estates Limited. You can get them on 0744 8619711. And Eagle Heights International School, your Mathematics Tuition Center, here to support children from year 7 to 13. You can also get them on all social media handles at Eagle Heights International School. Today we are going to talk about applying for health and care visa in the UK. What is health and care visa in the UK? And with me today is our usual solicitor and partner of BWF Solicitors, Mrs. Eunice Achampong, who is here to shed more light on this other aspect of applying for visa in the UK. I think today we are focusing on healthcare professionals. They've done so much for us during this COVID pandemic. They've been going back and forward, so working ridiculous hours, trying to make sure that people who are going through different ailments, people who have got the COVID, any other illness which is associated with the COVID, trying their very best to make sure that people get back to their normal health. So today we are concentrating on them, and Lawyer Eunice is here to take us through health and care visa in the UK. Good morning, Lawyer Eunice.
Hello, Vicky. How are you? That's good. Yes, I know that today of all days we've chosen this topic, and I'm hoping that our viewers will be able to take a lot from our topic today. This topic, I know, is something that usual people who would want to come and work in the UK may also look to apply to. Currently, as of this week, from the 1st of December, our immigration rules got a different sort of clothes, should I put it that way. So they've been updated, and now that we are in our transition period, I think most people should now know that from the 1st of January 2021, a lot of things will be changing. And I think the government has put a lot of money into advertising that things are going to change for businesses and individuals and immigration as well. And so this week, our immigration rules got a shake up. They now have implemented all of the points based system rules within our immigration rules. And the points based system is basically the new immigration system whereby people who want to come and live and work and visit the UK will have to now apply under. So if for any reason you think that you are somebody who wants to come and live in the UK after the 31st of December 2020, then there's been a shake-up. So this is basically to let people know that there's a new points-based system, and if you want to come and live and work in the UK, these are the rules that you have to meet to be able to enter into the UK. Yeah.
My goodness, with this new shake-up, is it that probably they've relaxed the rules or they've rather tightened the rules?
So they've added some bits to the rules. So whereas before you have EU nationals come in, and then as long as they say that they are working, they will be able to then apply for residence card or apply for registration certificate and just live in the UK. It will no longer be like that. So free movement is ending as of 31st December 2021. So they are going to put EU nationals, their family members, and any national in the same category. So they are putting them on the same footing, such that if they want to come and live in the UK, they are saying that now the rules that you have to go by are what we have now implemented. So no more coming into the UK and just showing that you're a worker and then you can live here. Now you will have to actually apply for a visa either as a skilled worker within the labor market. You can apply within the health and care industry. You can apply as a student if you want to come and study. You can apply as an innovator or a business entrepreneur who is going to start up a business. You can apply under the global talent route. So there are different routes now that have been implemented within the immigration rules so that those who are EU nationals and those who are non-EU nationals are on the same footing if they want to come and live in the UK or work and study in the UK. So that's the shake-up that has taken place. Obviously, they said they are simplifying it, but I don't know how how simplified I can say the immigration rules are, but they are they've added to it basically. So they've added different routes to what we now have. Before, most people who want to come and work will apply under the tier 2 visa route, or ministers of religion could apply under the tier 2 visa route, and other general workers could apply under the tier 2 visa route. So people who necessarily may be working here now may be under that tier 2 system. So that was a tier system where people would usually apply under if they wanted to come and work in the UK, and students as well would apply under a tier 4 system. But now they're saying that we're no longer going to go by that tier system. We're going to make it solely based on points, so that if you are able to meet certain required points, then you can apply for a visa under any of the routes that we have specified. Yeah.
So straight to the requirement. What are some of the eligibility requirements? What documents will one need? Anyone is watching us.
Okay. Yeah. So specifically, as you said today, we are looking at the health and care visa route. And that started earlier on this year, on the 4th of August. So they opened up the application route, because usually they say that if you want to come and work in the UK, you have to apply for the job first. You have to be able to be given a job offer. And so a lot of the visa applications will be made 3 months ahead of when they would have to start, obviously, in the job. So usually once you've applied, got the offer and all of that, then you can make the application 3 months before you are due to start the job. So usually in a case like this, if you are a health person, a health worker, they're looking for somebody who will be able to work as a health professional, such as a nurse, midwife, paramedic. They have those who work as general practitioners, which is the GPs. You also have pharmacists, dentists. There's a whole list of people under the health professional section. And they are also looking for people who will be able to work within the care industry as well. So in Britain, we have a very big care industry, especially those that work within the elderly care homes and the rest of it. So these people are also included within the care industry. So if you think maybe you're outside of the UK, you are a qualified health professional, you think that you'll be able to work within our health and care industry, then they're saying to you, make an application to any sponsor who is listed on the register of licensed sponsors on the uk.gov.uk website. So when you go on the .gov.uk website, you have a whole list of people on the register. So it's a register for licensed sponsors, and you are looking for somebody who is within the health and care industry. So if you go onto their website and they have placed a job vacancy on their website that they're looking for somebody, and usually they would have to have placed the vacancy or advertisement for a period of 28 days before they can say that, well, we didn't find anybody within the UK who can meet those requirements, and therefore we've had to advertise it so that people from other countries can apply for the job. So if you think you are able to apply for that job, yes, please do apply, make an application as on their website. And if you are given an offer, that's the first requirement. So they say as much as possible, once you're granted an offer, then they would obviously, the employer would obviously ask you for certain details which you would have to them, and if they are satisfied, they will give you a certificate of sponsorship. So they will grant you a certificate of sponsorship that will tell you the job role, the dates you're due to start, how much they're going to pay you, their reference number, and the rest of it. And under the points-based system, if you are able to get an offer, which will be the certificate of sponsorship, that is 20 points on the points-based system. You need a total of 70. So if you have 20 points because you've been given a job offer, then praise God, hallelujah. If as well you want to apply under this route, you will need a total of 70 points, as I said. So you will also need to make sure that you meet the English language requirement. So as we are in the UK, the English language requirement cuts across almost all the visa routes. So you will need that English language requirement to be able to get another 10 points added on to the points base that you are supposed to reach. So once you're able to get at least a level B1, so they're looking for your English speaking and writing and listening skills to be at least a level B1. So if you're able to get an ESOL, if you don't have an undergraduate degree or a GCSE, which is equivalent to a level 3, or some sort of A level, which is equivalent to a level 3, then obviously they're looking for something that can show specifically that maybe you've done the English language, which is the English speaking and listening, at a level B1, or you have some undergraduate degree and you have had it NARIC assessed. So you have to have the UK NARIC board assess it if you are applying from outside the UK, to make sure that it meets that level B1 grading or standard that they're looking for. Or as much as possible, some employers will undertake their own assessment. So sometimes they will assess you at the required level that they want you to be at, and then they would say, yes, you do meet that English language requirement. People who are applying from English speaking countries, and there's only about 18 on that list. So people like people from America, Jamaica, most of the Caribbean countries are on that list. There are some EU countries on there as well, but mostly you can check those English speaking countries on the .gov.uk website to be sure that you are under that list. If you are an English speaking country, then you wouldn't need that English language requirement, because you would just have to show that as much as possible you are from an English speaking country, and therefore you don't need to meet that requirement. So automatically you'll be given that 10 points anyway. And then you also need to make sure that the qualification that you have in your country as a health professional meets that required skill level that they are looking for. So they are looking for somebody who meets a required skill level of at least a level 3. So usually, I know that most of our education system is graded in levels. When I was at university, you know that you are doing a level 7 upwards. So if, for instance, you finish senior secondary school, I think at that level you'll be at a level 5 or 4 or 6. So usually they're looking for somebody who can meet a level 3 qualification grading and upwards. So somebody who can meet that required skill level 3 or upwards. And if you think you can meet that required skill level, that will be another 20 points added on to the points-based grading that they would give to you. So the job offer is 20 points. That required skill level of at least level 3 is also 20 points. The English language is also another 10 points. And then they look at your job that you're going for. So the job salary. So if the job salary within this health and care industry is about 20,000, the minimum, the least is about 20,480. So that should be the least salary that you will be offered in that job. So at least 20,480 pounds a year should be the least amount that they will offer you as a salary. If that is the minimum, then that will be something that they would say that, yes, you can meet 10 points if that is your least salary. Usually, if your job is within something that they call a shortage occupation list, most people within a shortage occupation list are people who, within the UK, they feel that the skills that are required are of a short level, or there are not many people who are qualified for that job within the UK, and therefore there's a shortage occupation list of jobs that require third country nationals or EU nationals to take those jobs in order to fill in those vacancies. So if your job, which is most healthcare jobs within the UK, are on the shortage occupation list, and so because most health professional jobs are on that shortage occupation list, that sort of boosts your points to give it that 20 points that you need. If for any reason you think that your job salary is more than the 20,480 that I mentioned, so maybe you are earning from 23,040 onwards, usually they will say that the least amount of salary you should be offered will be 25,600. But because most people within the shortage occupation list will be offered less than that 25,600, they've made the grading quite specific for those people. So if they are able to meet that minimum salary within that shortage occupation list, that will be another 20 points. And if their salary is more than the 20,480, that is an additional 10 points for any salary between the 23,040 and the 25,600. So that, of course, will boost your grading up to the 70 points that you are looking for. Once you know you've got your 70 points, then you can make the application. They want you to, as much as possible, provide your identification, which is your passport or your ID, which shows your nationality and your facial image. They also want to see that certificate of sponsorship from the hospital or the care body that you have applied to. It will have the employer's reference number, their sponsorship registration number. It will have the job role that you've been offered, the date you're meant to start. It will have the salary that you'll be paid, and those things are needed within the application process. They would also need to see, if you're applying from outside the UK, that you have something that they call a certificate for I think crimes. So for instance, we call it DBS or enhanced certificate. So they will need some sort of certificate to show that you have no criminal record in the country that you are living. So if you've lived there for the past 10 years before making your application, they need that certificate to make sure that you are obviously not on any criminal database or whatsoever.
Yes.
Yes.
About Ghana, do we have anything like that?
Yes, we do. In Ghana, do you know one thing? There was a time that my dad needed this because he was applying for a pastoral role, and they said to him, "You've lived in another country before you came to the UK, and because obviously we want to make sure that you have no criminal records whatsoever, we need that certificate to make sure that you have no criminal records." And they do, and it's quite expensive. I think every country does. Unless you inquire, you will unfortunately not know what it is that they are referring to. Yes. Yeah. Yeah. I think every country has it. It's just because we don't need it, so we don't inquire about it. But it's just one of those things that as a nation, every country will have that system in place just so that they have a record of people who have committed crimes, so that if you have yes, if you have no records whatsoever, then you know that that certificate of criminal record will not have anything adverse in there. But of course, I mean, our record keeping system in our third country are not superb. Yes, yeah, yeah, yeah. So that's one of the that's one of the things that obviously they would need just to make sure that you are safe and sound. And also, in terms of our usual tuberculosis, so if you are coming from a country that has been listed as a country which is at risk or prone to tuberculosis, you also need to have that test done. So you need to get that medical certificate. It's usually this yellow medical certificate. Some countries don't have the test centers because there are certain approved test centers. So it has to be by an approved test center. So countries such as Burkina Faso, Togo, Niger, Equatorial Guinea, they all have to come to Ghana to come and take these tests because unfortunately they don't have these test centers in their country. And in Ghana, we just have the one test center in Accra, MedLab, where people usually go to be tested. I think they have one currently in Kumasi as well, but the one in Accra is the most popular one. Is always busy, and so you also need to get that done. And it's usually the cheaper. Sorry,
Is that the same company that does DNA as well in Ghana?
no,
Approved. Okay.
no.
Okay.
So the DNA companies are completely separate from the tuberculosis test center. So those ones, the tuberculosis test center obviously is one that has been approved, so they know how the procedure is when they're taking the test and how they want them to take the test. And so that is completely separate from the approved DNA companies. There are specified DNA companies that have different locations in different parts of the world, but it's not the same as the tuberculosis test center. That's completely separate. So for the tuberculosis test to be done, they usually have to go book an appointment, and I think it takes a day for the test to be done, and then for them to give them the medical certificate. So once they are given that medical certificate, it will be valid for a period of 6 months. So most people who are applying for a visa under this route would usually be granted 3 years or more. And if your visa is going to be for 3 years or more, then that means that you definitely need to have that tuberculosis medical certificate, and that will be part of the evidence that you'll be providing in terms of the application as well. And as I said, if you are somebody who is applying under this health and care visa route, you can also make an application for your spouse or your child to also join you. So they don't just say that because you are making the application, so it's limited to just you. You can also make the application for your family members as well. So as much as possible, the things that I've mentioned, including the certificate of sponsorship, your passport, the tuberculosis medical certificate, the certificates for your criminal records as well, and also the things like the English language. If you've done the ASL test, they will need that as well. And then as much as possible, they will need to see the funding you have available. So if you are coming to make the application fee is about £232 for a 3-year visa. And then you have to make sure that you have at least £1,270 in your account, at least for 28 days before your application is due to be submitted. And they want to make sure that the money is in there for that period of 28 days within the 31 days that you said you are making the application. And I think the reason being is because when you first come, you're going to work for a month before you get your salary. So they want to be able to show that you can maintain yourself for that period of time before your salary comes in. So they want to see that £1,270 so that at least when you'll be able to maintain yourself without recourse to public funds, because you're not allowed to have public funds, or you cannot apply for any sort of benefits on a work visa. And the current good thing about the application system is that there's no IHS, whereas with most other visa routes, you would have to apply with the application fee and the IHS as well. But with the health and care visa route, since COVID started, or should I say, since Mr. Boris Johnson realized that immigrants are very important to our national health care, the ministers, or should I say, the Secretary of State for Health and the Home Office decided to put some concessions together so that those who are working within that industry would not have to pay that immigration health surcharge. So they are exempt from paying that health surcharge. They only have to pay the application fee and then pay any other fees for their family members if they are bringing them. But they have to make sure that they have that maintenance money in their account, unless the employer is willing to say that, yes, I am going to sponsor you or maintain you within that month before you get your pay. Then obviously it will say on the certificate of sponsorship that the employer will do that. But if not, then it means that you have to have that £1,270 for yourself before making the application as well.
Yes, and let me quickly say, ladies and gentlemen, viewers, if you want to send in your questions, please do on our social media handles. We are live on Facebook, YouTube, Periscope, and all social media handles. If you want to send in your questions, please feel free and send in your questions. Lawyer Eunice will be very happy to answer your questions. Yes, Lawyer Eunice, the questions have already started flowing in. We've got someone who sent in a question. My sister is a qualified nurse in Nigeria. How can she apply for a health care visa to the UK? With the explanation you've given us with the requirements, it applies to everyone to the UK.
Yeah, so anybody applying from outside the UK, you definitely need to have 70 points. And that 70 points is accumulated by first getting an offer from that employer. So as I said, the employer has to be an employer that has been listed on the register of licensed sponsors on the .gov.uk website. If they are on as a healthcare provider, such as the NHS, our hospitals, or if they are applying to an independent care body, most care bodies will also maybe be listed on there, but you have to check because not every care home will be listed on that register for licensed sponsors. So you would have to check and be sure that they are on that register for licensed sponsored if they want to apply to a care home or if they want to apply to a hospital. They must make sure that they are on that register. And usually once they go onto their website, they then would be able to see if there are any vacancies available for any job roles that they are looking for, whether it be a nurse or a social worker or a care professional, whatever role that they are looking for. If they have that vacancy available within that institution, then they can make the application for that job role. Once they are given an offer for that job, there will be certain requirements that the employer will ask of them, and then the employer themselves can give you a certificate of sponsorship. So that certificate of sponsorship is what will acquire you the first 20 points. And then they want you to make sure that the level of the skill level that you are at is at least a required level 3. So a level 3. So most of the time, different stages of your education, you have different levels that you have to meet. And I know that for...
I don't want to cut you short there. It's because we've got so many questions and time. I believe that what the explanation you are giving to this person who's asked the question has already been explained in your requirement. The requirements. So if you don't
Okay.
mind, we will just come quickly from this question, but it will look like we are repeating ourselves again. Then we jump on the next
Okay.
question because we've got a few more questions that are in, just trying to make sure that we cover
Okay.
all those questions before the end of the show.
Okay.
Thank you. The next question is I'm here in the UK as a student studying dentistry at the University College of London. Is it possible for me to apply for a work permit visa under the health and care route?
Okay, so this person is already in the UK. That's a good thing because at least they are given the opportunity to switch. Most people, apart from people with visit visas, can switch from whichever route they are on to this health and care visa route. So once they know that this is the route they want to go into, they might as well make the application to switch to a health and care visa route rather than um, stay on a student visa route if they don't have any more studies to complete. So they can switch and they have to meet the required points, as I mentioned before, that they have to have the job offer, they also have to meet that required skill level, and then they also have to make sure that they have that English speaking at a level B1. And then they also need to make sure that they have the required salary level. So if they don't have the minimum and they have more than the minimum, which is 20,480, and they have more than that, that boosts their points to at least 10 points if they have more than the 20,480. And if they are within the shortage occupation list, that's 20 points. If they are PhD graduates, that automatically puts them to 20 points as well. And so usually those are the requirements to be able to meet the points that they need. So if they need at least 70 and you get more than the 70, then you know that you are eligible to apply under that visa route. So this being the health and care visa route, once you're able to accumulate it, through the English language, the job offer, the required skill level, the salary level, if you're on the shortage occupation list, and all of that, that would just increase your points. If you have the points to be able to make the application, he can then or she can then submit the application within the UK. And the good thing about this route is that they've now made it a bit easier for people to apply using an app. And the app is called UK Immigration ID Check app. So it's UK Immigration ID Check app. And so with that app, they are able to also give their facial image and then go on and make the application online as well. So they start the application process online. They give their identification, or should I say biometrics, on this app, and then that will go on onto their application system, and they are able to then upload the documents that they need. So whatever documents that I've mentioned, such as your passport, certificate of sponsorship, you will not need a TB test because obviously you're applying from within the UK, and you not need that what do you call it? You don't need. I was going to mention something else, but in terms of the certificate of criminal records, you would need that because you have previously lived in a country apart from the UK before you came into the UK. So they will need that certificate to make sure that you don't have a criminal past. So definitely they will need that one, and they'll also need the documents to show that if, for instance, you're saying that you'll be able to maintain yourself, your bank statements, for instance, will show how much you have in your account. So if you are applying for yourself, then you should have maintenance of at least £1,000, 270. So 1,270 should be in your bank accounts for them to know that you'll be able to maintain yourself before your first salary comes in. If you're applying with your family members, then obviously they would also need to show evidence that they are your family members as well. But in this case, as long as you are able to submit the application online and also do the ID check app as well, you'll be able to complete the application process, pay for it, and then they say that within a period of 3 weeks, they should be able to make a decision on the application.
The next question is I already have tier 2 work permit visa as a midwife in the UK. I came here about 2 years ago, and my visa is due to expire in October next year. I want to move to another hospital when applying for my visa extension. Is it possible?
Yes. So usually once you make the application the first time, they want you to continue within that job role. And if you want to change your job or you want to change the role in which you are working in, you have to inform the Home Office, or you have to make sure that this is something that the Home Office is aware of. So usually, if you are saying you're changing jobs, so you used to work at Croydon University Hospital, but you now want to go and work at St. George's Hospital. If you want to do that, then it means that you have to be able to meet all the eligibility requirements that I just mentioned. And the job offer has to come from that specific hospital. It's not that you say that you want to change jobs and then immediately you just change. It has to go through the required processes. So if you want to change jobs to, let's say, a different hospital, or let's say a different care home, that job offer has to come directly from that specific employer. So it means that you have to meet the eligibility requirements all over again. And that means that you have to make an application for an extension of your health and care visa. So if previously in this lady's scenario, she applied for maybe a 3-year visa because she said she's already done 2 years and she's due to have an extension next year, October. So in this case, she will have to apply, getting a job offer from the institution or from the employer that she wants to work for. She will have to show that she's able to meet that required skill level, and I'm sure she will have the evidence to show. She will have to show that she's able to meet that English speaking at a level B1, and she will also have to show that her salary level for this job that she will be going to work at is more than the 20,480. So maybe it's between the 23,040 or it's about 25,600. So if she has that required salary level, that will boost her points as well. And if it's within that shortage occupation list, as I was saying, that will also boost her points as well to at least 20 points more. So in this case, if this person were to be applying, they will have to meet all of the eligibility requirements again in order for them to be given an extension of their visa. And it's fantastic because at least once you're able to meet all of those eligibility requirements, you can then switch from your old employer to your new employer. And it will be the same if you were, for instance, changing job roles. So, for instance, you no longer want to work as a nurse within the hospital. You now want to work as a care provider within a care home. It will be the same thing. So you will still have to meet all of those eligibility requirements to change your job role from one role to the other. So yes, she can do the switch as long as she meets the eligibility requirements.
The next question is, I'm here as a nurse and would like my son and husband to join me in the UK. How do I go about it, and when can I apply for my indefinite leave to remain in the UK? I think you did mention of this during the eligibility you were taking us through the eligibility. So now, thank God, someone is asking how, her husband and son can join her, in the UK,
UK.
and also apply for indefinite leave to remain in the UK.
Amen. Okay, so for family members, what it is that if the person is applying as a spouse or as a child, they will also have to pay the required application fee. And usually, in a case like this, if the person who is working here in the UK has 3 years, for instance, it will be the same amount of leave they will give to the husband or the child when they are applying. So if it's a spouse and let's say 2 children coming, then it means that they need to show evidence that they are related as said. So the marriage certificate, the birth certificates will need to show that they are a sponsor here in the UK, has maybe 3 year visa or a 5 year visa, and therefore they are applying as dependents on her to be able to meet the requirements. So I'm sure that those requirements that were met by her, they will be able to provide evidence that she now has this leave. So maybe if it's a 3 year leave, her biometric is showing that she has this 3 year leave, and they are showing that they are family members of this person who has been granted the visa. And they will also need to show that they will be able to maintain themselves for the first few, should I say, weeks before they come in. So if it's a spouse, usually they are expecting that the spouse will be able to show at least that they have at least, is it £315 in their account. Then the additional child, or should I say the first child, will be at least, I think it's 200, just over £250. And then every additional child will have to show that they have at least £200 in their account. And like I said, that should be in the account for a period of 28 days before they make the application. And that period of 28 days must be within 31 days of the application being made, just so that they know that this person, when they come, they will be able to maintain themselves before the first salary probably comes in. In a case like this, if the person is already in the UK, I'm sure they will just be able to show that yes, yes, I do send money for their maintenance at home. And so these are their bank statements. Their bank statements show, for instance, the husband's bank statement will show that they have more than maybe the money that they are required to have in their account, or because the woman is already working, she can show her pay slips, her bank statements for at least 6 months, a letter from the employer as well. And then they can make the application. Once it's approved, they will be given the same level, or should I say, the same leave that the sponsor here in the UK has. So, if, for instance, she's been granted 3 years and is ending next year, February, the family will also be given up to next year, February. In terms of applying for indefinite leave to remain, usually most people on the work permit visa can apply after 5 years of living here legally. So if they have literally got a work permit visa, which is 3 years, and they've extended it, after a period of 5 years, they can apply for indefinite leave to remain, and they can apply with their family members for indefinite leave to remain in the UK. So once her 5 year period is over, she can obviously show that she's still working for the employer, if they are still working for that employer, the pay slips and the bank statements and the letter from the employer, and obviously her biometrics to show that she's lived here legally for that 5 year period, and then the evidence of her family members, which shows that there are her husband and children, and also the fact that obviously because they've stayed here for that long period of time, they want to make the application for indefinite leave to remain in the UK. So after a 5-year period, they can apply for indefinite leave to remain in the UK. So yes, this person can make the application for her spouse and 2 children to join her, and once the 5-year period is over, they can also apply for indefinite leave to remain in the UK.
This is coming from me. I just want to find out why at this time is the government, um, putting these measures in for people to apply to, join the health sector. Is it because
Mhm.
of, COVID pandemic and the extreme pressure on our current healthcare professionals? Why are they
I
around
think,
this time?
yes, I think this time they've decided to specify this category because of the fact that a lot of people, like I said, within our care industry are people that work, I mean, from are people that are from outside the UK. They're not necessarily people that are from within the UK. So a lot of people within our care industry are normally people that we will call non British, or people that are from the EU or from other countries. So they've specified that route, I think, because of the fact that most of the employees within this route are not necessarily UK citizens or settled citizens within the UK. And it's very important that we remember that, especially during this COVID period, it is those professionals within the care industry that have actually made a difference, especially within people's lives and in our Prime Minister's life. So that has that has also brought about this exemption from the immigration health surcharge, so they don't have to necessarily pay for it. And it's a good thing also for the fact that people who are in this industry can bring along their family members as well. And I think it's a profound thing that when you realize that your work industry is not one that is necessarily conducive to should I say our people here, then you have to place more emphasis on it when people are making that application. As I said, most professionals will also be um, under the shortage occupation list. So most people who are within the health and care industry will be under that shortage occupation list because they can't find anybody within the UK who will be able to take up those roles. And therefore, most of these people will come under that shortage occupation list. And that's why I think they've emphasized more on this industry or this health and care sector, because it is more likely that most of the workers from within the UK would not apply, or they don't have the required skill level, and therefore it is people that are outside of the UK that will meet the required skill level to be able to do the job. Yeah.
And I've also realized that during this pandemic, there are lots of health professionals, some students as well,
Mm,
who needed to extend their visas. So many conditions. I think
yes.
the home a bit, relaxed the rules a bit to favor them. Am I right?
Yes. Yes, because as students, most of the time you have a specific number of hours that you are allowed to work because you're on a student visa. So there are restrictions as to the number of hours you can work. But because most of these students were within the, should I say, health industry or health and care industry, they were allowed to work more than their required 20 hours that they will be, I mean, they're used to working every week. So they increased the number of hours so that they wouldn't penalize them for working more hours than they should during this COVID period. And most of them, um, who are students as well, would also have been given the chance to make the application earlier than usual for work permit visa, or as they now call it, health and care visa. So if they were meant to graduate in the summer, they quickly were able to make those applications under the health and care visa route to be able to continue in their desired profession. And so a lot of them were just so excited about this and were just making those applications. And now we know that they don't even have to pay the IHS. So I'm sure they were ecstatic when this news also came. So it's a good thing for most professionals within this industry.
Like you said, our time is up for our Eunice, but I think I'm to ask almost most of the questions. But if viewers have more questions to ask Lawyer Eunice or need guidance, they can definitely get in touch with Lawyer Eunice. She will put her details forward for anyone who is interested or need further clarifications or guidance on this issue. So, Lawyer Eunice, as we usually do every,
Yeah.
Saturday, just put your details, out to them for them to get in touch with you, probably to take this forward. Yeah.
Okay. So, as you mentioned, I am a solicitor at BWF Solicitors, and we are situated in Seven Sisters. We're just close to the Seven Sisters Underground Station. If you are coming by bus or you're coming by train, you get to the Seven Sisters Station and you ask for exit 2 or Anna House. You'll be directed to this large, tall building just around the Seven Sisters station. We are on the fourth floor of Anna House, and the address is 214 to 218 of Tottenham High Road, London, postcode N15 4NP. And our telephone number is 0208 493 7340. Our offices are usually open from Monday to Friday from 9:30 to 6 p.m. And my personal number out of office hours is 075 3581 3910. So yes, if you have any further queries, do give us a call and we'll be able to help you.
Yes, Eunice, we always appreciate you. Thank you so much for coming, on our platform to educate us on these legal issues. I would also like to take this opportunity to commend all our healthcare professionals who have been working so hard to take care of us, not only in the UK, but all over the world, especially Africa, Ghana as well. They are
Yeah.
doing their best, to make sure that this COVID-19 will not take over humanity. But definitely, we are surviving. Thank them so much
Yes.
for, yeah, we do really appreciate them. But Eunice, I hope you have a wonderful week. We will definitely see you again, and same time next Saturday. That interesting topic. Have a lovely weekend. Yeah, ladies and gentlemen, there you are. Today we're discussing health and visa. We were, trying to focus on our healthcare professionals. We don't have enough healthcare professionals in the system in the UK. We need extra healthcare professionals to help relieve those who are, under so much pressure in our hospitals. Therefore, the Home Office has put in place measures for any healthcare professionals who would like to come and work in the UK. This was what we're discussing today, how to, apply for your health and care visa to come to the UK to work as a healthcare professionals. And Lawyer Eunice did justice to the topic as usual. If you want to get in touch with her, she's put up all their details. Contact her and she'll take you through the application process. If you are within the UK and you want to extend your visa or want to bring your family to join you in the UK, yes, you can do that, but you need the right, advice. So please, I advise you to contact Lawyer Eunice of BWF Solicitors, and she will take you through the process successfully. Ladies and gentlemen, today at 4 o'clock, I have another wonderful guest joining me on our platform, and she's no other person than the first female MP of Croydon Central, Sarah Jones. She will be with us to talk to us about issues, current issues. So please do join us at 4 o'clock. And if you have any questions, please do not hesitate to send all your questions to us on our social media handles, and I'll be able to pass those questions on to Sarah to answer those questions as well. On that note, I hope to see you at 4 p.m. for our discussion with our MP for Croydon Central, Sarah Jones. I'm so excited, and a lot of people have been in touch with me. I'm super excited to join in the discussion. So please do not miss it. 4 p.m. Join me live, Heritage TV, hanging out with Vicky, and let's keep the conversation going. Thank you so much for staying with me throughout the program. Hope to see you again 4 p.m. today. And I say a very big thank you to the team of BWF Solicitors, especially Mr. Bernard Owusu, for all your support. We really appreciate it. And thank you, viewers, as well. Take good care of yourself, and please do observe your social distancing. Keep your face masks and sanitize your hands. Wash your hands at all times. We love you. We want you to stay alive. See you again. Take care. Bye.
At BWF Solicitors, we take pride in our clients' service. As a niche law practice, we are conscious of the demands of our clients. We always offer a friendly, listening ear and sympathetic attitude. We've worked with thousands of people all across the UK in all areas of personal legal services. We have received great feedback and reviews from our clients. We are located at Seven Sisters in Tottenham on the 4th floor of the Anna House, right on top of the Victoria Line train station for your utmost convenience. We have a friendly office and provide all of the refreshments necessary while you wait to see a lawyer. We are dedicated to our clients and have a successful record of serving our clients. Solicitors of England and Wales are of high quality and are bound by the highest professional standards. We are officers of the court and are bound by standards of integrity, competence and conduct as part of our responsibility to uphold rule of law. Our solicitors and lawyers care about your case and are committed to providing the best possible service to you in the most considerate and careful manner. We hold 2 Law Society quality marks. Law Society accreditation helps to demonstrate that we have attained the requisite standard in the area of law and have the requisite expertise. BWF Solicitors, we're here to help you with your legal services when you need us.